It was 6:45 a.m. when Joyce, a 68-year-old retired office manager, woke up with her words slurred and her right hand trembling. Just hours earlier, she had gone to sleep like every other night, peaceful, warm, safe in her favorite recliner where she had been sleeping for months to help with her acid reflux. By sunrise, she could not hold her coffee cup. The doctors called it a silent stroke, one that hit during sleep. Without warning, without the dramatic symptoms we see in movies. Joyce had no high blood pressure, no known heart disease, and had always prided herself on staying active. But what she did have was a common habit that millions of seniors share: sleeping in positions that unknowingly restrict blood flow to the brain. What felt like comfort was actually creating silent risk. Here is the truth that could change how you sleep tonight. The position you choose for rest could determine how clearly your mind works tomorrow. Welcome to Senior Health Facts, your trusted home for science-backed wisdom, designed especially for adults over 60 who want to age with strength and independence. If staying healthy and protecting your brain matters to you, please hit that subscribe button right now. Because what we are sharing today is not just information, it is potentially life-saving knowledge that every senior needs to know. As we move through our 60s and beyond, our bodies undergo changes that make sleep position more critical than ever before. Blood vessels become stiffer, losing the flexibility they had in our younger years. Our breathing naturally becomes shallower during sleep. And circulation slows as our hearts work a little harder to pump blood throughout our bodies. All these natural aging changes make our brains more vulnerable to low oxygen levels, blood clot formation, and early morning blood pressure surges. Three of the leading triggers of nighttime and morning strokes in adults over 60. But here is what most people do not realize. Sleeping posture directly affects how blood flows to and from your brain. According to a 2022 study published in the medical journal Stroke, brain oxygenation varies significantly depending on head and body positioning, and this effect becomes more pronounced as we age, especially in adults over 60. Why does this happen? Think of your blood vessels like garden hoses that have been used for many years. They are not as flexible as they once were, and they may have some buildup inside. When you position these hoses at the wrong angle, water cannot flow smoothly. That is exactly what happens when poor sleeping posture restricts blood from draining properly out of the brain, or when it prevents fresh, oxygen-rich blood from reaching the brain efficiently. The encouraging news: with just a few thoughtful adjustments, using gravity to your advantage, ensuring proper airflow, and providing the right support, you can sleep more comfortably and protect your brain at the same time. Let us examine 6 common sleeping positions and nighttime habits that may be putting your brain at unnecessary risk, and discover what you can do tonight to sleep safer. Sleeping completely flat without any head elevation might seem like the most natural, restful position, but lying totally flat forces gravity to work against your circulation. When your head is at the same level as your heart, blood tends to pool in your brain instead of draining efficiently. Oxygen levels can dip gradually throughout the night, and the risk of small clot formation increases, especially during those early morning hours when blood pressure naturally spikes as your body prepares to wake up. Many stroke survivors report feeling slightly lightheaded, congested, or foggy upon waking, early warning signs that their overnight circulation was not optimal. The safer approach is to create a gentle 30-degree angle elevation using a wedge pillow or by placing firm pillows under your upper body. The key is keeping your head and neck properly aligned. Never sleep with your chin tilted downward, as this compresses your airway and makes breathing more difficult. While stomach sleeping might help reduce snoring for some people, it creates a dangerous combination of neck compression and reduced oxygen intake. Sleeping on your stomach forces you to turn your neck sharply to one side for hours at a time. This position reduces blood flow through the carotid and vertebral arteries, the major highways that carry oxygen-rich blood to your brain. The danger multiplies if you use a thick pillow, which tilts your neck at an even more extreme angle. Take sleep medications, or have conditions like sleep apnea or high blood pressure. This combination can create a perfect storm of reduced oxygen and impaired circulation. Better choice is to train yourself to sleep on your side with a supportive pillow that keeps your neck in a neutral position. Not too high, not too low, just properly aligned with your spine. A surprising number of seniors develop the habit of covering their head with blankets or pillows to block out light, reduce noise, or simply feel more secure and cozy. Unfortunately, this innocent practice quietly reduces the oxygen you breathe and increases carbon dioxide levels around your face throughout the night. Studies have linked nighttime low oxygen levels not just to stroke risk, but also to accelerated cognitive decline and memory problems. Let me share Robert's concerning example. A 72-year-old retired mechanic was found unresponsive one morning by his daughter. His oxygen saturation had dropped to dangerous levels overnight. The culprit was that he had developed a habit of pulling his comforter completely over his head to stay warm and block out his neighbor's porch light. Safe alternatives include using a comfortable sleep mask for light control, installing blackout curtains, or choosing breathable lightweight bedding that keeps you warm without restricting airflow around your face. Many seniors with conditions like acid reflux, back pain, or breathing problems find that sleeping in a recliner helps them breathe easier and reduces discomfort. While occasional recliner rest is fine, making it your nightly sleeping spot creates circulation problems. Sitting upright for 7 to 8 hours causes blood to pool in your lower body and legs, while your upper body, including your brain, may not receive optimal circulation. Your legs remain bent at the knees for hours, which can slow blood return to your heart. This pooling effect increases the risk of blood clots forming in your legs during the night. By morning, a clot formed in your leg could potentially travel to your lungs or brain. If you need to sleep elevated due to breathing or reflux issues, use an adjustable bed or a wedge that lifts your upper body while allowing your legs to remain relatively flat and extended. The position of sleeping on your right side with your arm tucked under your pillow feels cozy and secure. But it is actually a hidden circulation trap that many seniors do not recognize as problematic. When you sleep on your right side with your arm tucked underneath your head or pillow, you compress important blood vessels, including the brachial artery and jugular vein. These vessels are crucial for delivering oxygen-rich blood to your brain and draining used blood away from your brain. This position also puts pressure on the brachial plexus, a complex network of nerves that controls sensation and movement in your arm and hand. If you frequently wake up with numb, tingly, or dead fingers, this compression is likely the cause. A study from the Journal of Sleep Research found that prolonged arm compression during sleep can contribute to nighttime circulation problems and may even increase stroke risk in older adults, particularly those with existing cardiovascular conditions. The safer setup is to sleep on your left side instead, with your arms positioned forward and supported by a pillow, never tucked under your body. Use a contoured pillow that supports your neck's natural curve while reducing shoulder compression. Many seniors dismiss frequent nighttime movement as just part of getting older. But constant tossing and turning often signals that something in your sleep environment or position is not right. Each time you shift positions abruptly, it creates small disruptions in your blood pressure and oxygen flow. These micro-disruptions prevent your brain from entering the deep, restorative sleep phases it needs to repair and refresh itself. Research published in the Journal of the American Geriatric Society found that fragmented sleep, characterized by frequent movement and brief awakenings, has been linked to memory problems, increased anxiety, and elevated stroke risk in adults over 65. Common underlying causes include room temperature too warm or too cold, uncomfortable mattress or pillows, evening caffeine or alcohol consumption, untreated sleep apnea or restless leg syndrome, and anxiety or racing thoughts. What you can do is keep your bedroom cool around 65 to 68 degrees Fahrenheit, dark and quiet. Avoid caffeine after 2 p.m. and alcohol within 3 hours of bedtime. Practice gentle stretching or relaxation techniques before bed. Most importantly, if tossing and turning persists for more than 2 weeks, especially if you snore or gasp during sleep, consult with a sleep specialist for evaluation. Now let us shift from the concerning to the constructive. Here is exactly how to optimize your sleep for better brain health and circulation after 60. Use a 30-degree wedge pillow or stack firm pillows to create a slight incline. This gentle elevation helps gravity assist blood drainage from your brain while supporting easier breathing throughout the night. The elevation should be gradual, not sharp. Your entire upper body should be on an incline, not just your head bent forward. Think of it like lying on a gentle hillside, not propping yourself up at a desk. Sleeping on your left side offers multiple benefits. It improves lymphatic drainage, which is your body's waste removal system, reduces pressure on major arteries, and supports better digestion while putting less strain on your heart. Start by lying on your left side with a pillow between your knees to keep your spine aligned. Place a small pillow or rolled towel behind your back to prevent rolling onto your back during the night. Never tuck your arms under your body, pillow, or head. Instead, keep them in front of your body where they can rest comfortably without compressing blood vessels. Use a hugging pillow, a long body pillow that you can drape your arm over. This keeps your shoulder in a comfortable position and prevents you from unconsciously tucking your arm underneath you during sleep. Choose natural materials like cotton or bamboo for your sheets and pillowcases. These materials breathe better and help regulate temperature throughout the night. Never cover your face while sleeping, no matter how cold you feel. If you need complete darkness, invest in a comfortable sleep mask rather than pulling blankets over your head. If medical conditions require you to sleep elevated, try to limit recliner sleeping to short naps rather than full nights. If you must sleep in a recliner overnight, set a gentle alarm to remind you to stand and stretch every few hours. Every 2 to 3 hours, stand up, stretch your calves, flex your feet, and take a few deep breaths. This simple routine helps prevent blood from pooling in your legs. Go to bed and wake up at the same time every day, including weekends. This consistency helps stabilize your circadian rhythm, your body's internal clock, which in turn helps regulate blood pressure and reduces your long-term stroke risk. Choose just one of these changes to try tonight. Adjust your pillow height, switch to left side sleeping, or remove that extra blanket from over your head. Small changes can lead to significant improvements in how you feel when you wake up. It might feel different at first. Change often does. but give your body a few nights to adjust. Your brain will thank you for decades to come. Let us return to Joyce, the 68-year-old retired office manager who woke up that frightening morning with slurred speech and a trembling hand. Joyce's stroke recovery was long and challenging, requiring months of physical therapy to regain her strength and speech clarity. But she was fortunate. Many people do not get that second chance to make changes. When Joyce finally came home from rehabilitation, her daughter Sarah did not rush out to buy expensive supplements or complicated medical devices. Instead, Sarah made simple but crucial changes to how her mother slept. They replaced the old recliner with a proper adjustable bed. They added a gentle wedge pillow for elevation. Joyce learned to sleep on her left side with her arms positioned safely forward, never tucked underneath. Most importantly, they created a bedtime routine that helped Joyce feel secure and comfortable with these new positions. Today, Joyce does not just sleep safer. She wakes up clearer, more alert, and with the energy to enjoy her retirement. She tends her garden, volunteers at the local library, and plays with her grandchildren. And you deserve that same quality of life. You deserve restful, healing sleep that leaves you refreshed rather than groggy. You deserve mornings where your mind feels sharp and your body feels ready for the day. You deserve a brain that stays healthy and a body that remains truly yours. Here is your gentle challenge for tonight. Choose just one small change from what we have discussed. Just one dot. Maybe it is adjusting your pillow to create slight elevation. Perhaps it is trying left side sleeping for the first time in years. Or it could be as simple as removing that blanket from over your face and using a sleep mask instead. It might feel unusual at first. Most changes do. But give it 3 nights. Often, that is all it takes for your body to adapt to a healthier sleeping position. Your brain has been taking care of you for decades. Tonight, you can start taking better care of it in return. Ready to sleep safer and wake up stronger? Subscribe now, because our next video will share the 3 morning habits that can reduce your dementia risk by up to 40%. And they are simpler than you might think. Many people ask whether loneliness truly affects physical health. The evidence is clear. Prolonged isolation can raise inflammation and increase the risks for heart disease and memory decline over time. For most seniors, left-side sleeping offers the best combination of brain drainage, reduced heart strain, and improved digestion. However, if you have a left shoulder injury, recent left-side surgery, or certain heart conditions, you should discuss sleep positioning with your doctor. They may recommend modifications based on your specific health situation. This is completely normal and very common. The goal is not to maintain perfect position all night. That is impossible and unnecessary. What matters is spending the longest portion of your sleep time in a safer position. Start on your left side and use a pillow wedged behind your back to make rolling over less likely. Even spending 4 to 5 hours in the correct position provides significant benefits. Occasional recliner naps are generally fine for most people. The concern arises with nightly, long-term recliner sleeping where your legs remain bent for 7 to 8 hours. This position can slow blood return from your legs to your heart. If you must sleep elevated due to breathing issues, try to extend your legs periodically during the night, or consider an adjustable bed as a safer long-term solution. This is backed by solid research. Studies published in journals like Sleep Medicine Reviews have established clear links between nighttime low oxygen levels and increased stroke risk, memory decline, and even dementia progression. If you snore loudly, gasp during sleep, or frequently wake up feeling unrested. These could be signs of sleep apnea, a condition that should be evaluated by a sleep specialist. Look for a medium, firm, contoured pillow that maintains your neck's natural curve without pushing your chin toward your chest or tilting your head too far back. Memory foam cervical pillows and wedge pillows designed for seniors are both excellent options. Avoid overly soft pillows that provide no support, and replace pillows that have lost their shape or support over time. Let me share how sleep positioning can transform your health. Here are practical changes you can make starting tonight. For risky sleeping completely flat, the danger is brain blood pooling and reduced oxygen. Try gentle 30-degree head elevation with wedge pillow instead. This provides improved drainage and optimal brain circulation. For stomach sleeping with neck turned, this compresses neck arteries and restricts airflow. Switch to left side sleeping with proper neck support. You will get better blood flow and easier breathing. For covering your face with blankets, this creates carbon dioxide buildup and reduces oxygen intake. Use a sleep mask with breathable sheets instead. This maintains safe airflow while keeping darkness. For all-night recliner sleeping, blood pools in legs creating clot risk. Try an adjustable bed or wedge with legs extended. This provides balanced circulation and reduces clot formation. For right side sleeping with arm under pillow, this compresses blood vessels and creates nerve pressure. Sleep on your left side with arms positioned forward. You will have unrestricted circulation with no numbness. For constant tossing and turning, this disrupts sleep cycles and creates circulation instability. Establish a consistent bedtime routine and optimize your comfort. This leads to deeper sleep and better brain restoration. Here is your new, safer senior sleep routine to follow each evening and morning. For evening preparation, avoid screens 1 hour before bedtime. Enjoy light herbal tea like chamomile or passion flower. Do gentle shoulder and neck stretches for 5 minutes. Prepare your sleep mask and ensure room is cool at 65 to 68 degrees Fahrenheit. For bedtime setup, position your wedge pillow for gentle elevation. Start on your left side with body pillow for arm support. Never tuck arms under head or body. Use lightweight breathable covers and keep your face uncovered. If you wake during the night, avoid checking the time as this creates anxiety. Take 3 slow, deep breaths. Gently return to left side position. Keep a small notepad nearby for worrying thoughts. For your morning check, notice if you wake feeling clearer versus groggy. Check if morning headaches decrease. Pay attention to improved energy levels. Save this routine and share it with someone you care about. These simple changes could be the conversation that protects their brain health for years to come. The guidance in this video is grounded in peer-reviewed science and clinical experience, not speculation. Key sources include the Stroke Journal from 2022 documenting how brain blood flow varies significantly based on sleeping posture in older adults. The National Institute on Aging Comprehensive Review of How Aging Affects Blood Vessel Flexibility and Circulation Patterns. Harvard Health Publishing detailed analysis of how nighttime oxygen levels affect brain health and stroke risk. The American Academy of Sleep Medicine clinical recommendations for safe sleep positioning in adults over 65. And the Mayo Clinic Neurology Department evidence-based guide to identifying and preventing overnight stroke risks. Every recommendation we have shared today has been carefully vetted through multiple sources of clinical research and medical expertise. When it comes to your brain health, evidence-based information is not just important, it is essential. Before we finish, I want to share something important with you. Everything we have discussed today is designed for educational purposes, to help you make informed decisions about your sleep habits, comfort, and overall health as you age. This information should never replace the personalized guidance of your doctor or licensed healthcare provider. They know your individual health history, your current medications, your specific risk factors, and can tailor advice that fits your unique situation perfectly. Whether it is choosing the right sleep position, selecting supportive pillows, or addressing symptoms you might be experiencing, please have these conversations with your healthcare team before making significant changes. Every person's body is different. What helped Joyce in our story, or what works well for your neighbor, might need to be adjusted for your particular needs and health conditions. Your doctor is your best partner in this journey towards safer, more restorative sleep. They can help you navigate any concerns and ensure that the changes you make support your overall health goals. The most important thing is that you are taking steps to care for yourself. You deserve restful nights and energetic mornings. You deserve to feel confident about the choices you are making for your health. Take care of yourself, sleep well, and I will see you in the next video where we will explore simple morning routines that can sharpen your memory and boost your energy naturally. Sweet dreams, and thank you for trusting Senior Health Facts with your health journey.